There's good reason. Several of the COVID vaccines are 2 doses. Getting the second offers far better protection, but not everyone is showing up for that second shot. Gabriella Becerra looked into just how many are skipping their appointments locally. And Gabby, what did you find?
Well, Eric, it's definitely not the majority of people, but still, doctors say it's important that everyone finishes the 2-dose series for us to have the most protection against COVID-19. 1 in every 10 people who got the first dose of the COVID-19 vaccine at SSM didn't come back for their second.
This seems to be in line with the state's average. About 10% of patients never come back for their second dose.
VP of Pharmacy Services, Mo Karbat, says there's a few reasons why people might be skipping the second dose. The first, a rare but severe allergic reaction, which he says would be a good reason to not come back. But if it's because of common side effects, he says you should still get dose number 2.
If the first dose bothered you, then you may take an acetaminophen or another medication to help with symptoms such as fever, headache, or pain.
At UW Health, Dr. Matt Anderson couldn't be specific, but said there's a very small number of people not returning for their second appointment.
Do we know if they're getting their second dose somewhere else? No, that's not really transparent and visible to us.
Anderson says no matter where you get it, it's important that you do.
The first dose gives you some level of protection. We don't know the duration of that protection, and we also know that the top level of protection comes after the second one.
If someone missed the second appointment simply because of timing, Anderson says it might not be too late to reschedule.
Ideally, you'd get it within that 6-week time frame, but if it goes beyond that, there's no recommendation right now to start the series over again.
While the first dose still has some protection, Karbat says it's just not enough.
After the first dose, our bodies develop a certain level of immunity, but it's not enough. So we need the second dose to boost the immune response 3 or 4 weeks later.
Public Health Madison-Dane County isn't keeping track of the data, but a spokesperson says very few people have missed their second dose appointment, but still adds that if you did miss that appointment, make sure you schedule a new one.